As said, I am from Valencia College, and I will be presenting on the neurophysiological processes of addiction in individuals with high IQ. So what is addiction exactly? Addiction is defined as the ingestion of a substance or the engagement in behavior that can be pleasurable, but the continued use of which causes harm and interferes with daily activities, like work, health, relationships, things of that nature. There are two recognized types of addictions. The first is substance addictions, which would be things along the nature of psychostimulants, nicotine, things of that nature. The second is process addictions, such as engagement in behavior, gambling, sex, shopping, eating, all of those fun things. So the psychology of addiction is actually extremely important. The initiation of an addiction to either a substance or behavior is almost purely psychological. Dr. James White of England's Cardiff University actually performed a study in which he found that men with an IQ between 107 and 158 by the age of 30 were twice as likely to have developed an addiction. Women, unfortunately, were 3 times more likely. The question really is, how do we explain this? And a big part of it is that engaging in an addictive substance or a behavior fulfills the brain's need for innovation. So basically, the brain's kind of bored, and engaging in these addictions helps to fill it a little bit more. In fact, Dr. Daryl Anaba of the UCSF Medical Center once stated that the changes in the brain, differences or anomalies that make a person more prone to addiction, also endows that person with a greater degree of intelligence and more willingness to think outside the box. So let's talk about stress, because none of us in this room ever have to deal with that. Once the person actually initiates the either substance or behavior, anatomy takes over, partly due to the B-sub, ventral subiculum, located right about there. It's the primary output of the hippocampus, and its main role is fear conditioning, drug sensitization, and stress. Drug sensitization is a repeat administration of something like a psychostimulant with a heightened response to a single subsequent dose. So basically, it's the exact opposite of a drug tolerance. Deactivation of the B-sub would prevent this drug reinstatement, but unfortunately stress cross-sensitizes with psychostimulants. In other words, they both release norepinephrine, which activates that B-sub. So naturally it gets reinstated and creates that sense of well-being and alertness. Aside from that, we have the hypothalamus, the pituitary gland, and down right on top of the kidneys sit the adrenal glands. That's where we make up the HPA axis to stress. When a psychostimulant is introduced to the body, it releases corticotropin-releasing factor into the cerebrospinal fluid. So as a psychostimulant abuse rises, or as stress rises, so does the presence of CRF in the spinal fluid. Unfortunately, individuals with high IQ are more prone to certain stressors such as unhealthy perfectionism, social awkwardness, all of those fun things that we experience. So those more prone to stress are also more prone to become addicted to certain substances and behaviors. Next, we're going to talk about the reward center, which is extremely important in this whole ordeal. First is the ventral tegmental area, also known as the VTA, which is responsible for releasing dopamine from here up into this area, into the forebrain, and right through this section, the nucleus accumbens, which is known as the brain's major pleasure center. All of this will become a little bit more clear as we start going through each addiction. First one we're going to talk about is cocaine and amphetamines. These have a very interesting effect on the nucleus accumbens, which is that one right there. They actually block dopamine from being taken back up into the system by the dopamine transporter, so it has the ability to accumulate in the synapse right here instead of going back up into the system like it normally would. This is partly in part to the CAMK4 gene, which researchers at the Harvard Medical Institute found that individuals who possessed a particular mutation of this gene scored much higher on cognitive ability testing. Unfortunately, it also increased this dosage of cocaine and amphetamine addiction. A major study performed by Harvard researchers showed that maternal hypothyroxanemia before fetal development showed a correlation between TH-dependent cortical development as well as intellectual ability. So there's an interesting correlation that showed hypoactivity in the gene would reduce the IQ score, whereas hyperactivity would increase it. The next addiction we're going to talk about is alcohol, which is found in the BTA rather than the nucleus accumbens. It's mostly due to the dopamine receptor D2 gene, or DRD2. It's a particular A1A1 genotype, and researchers in Taiwan found that those individuals with this particular genotype also scored much higher on cognitive ability testing. Unfortunately, what happens is that it alters the response to dopamine. They found that this particular genotype renders the dopaminergic system inefficient and actually rewards alcohol abuse. So next is nicotine. And a major part of nicotine is the ChRNA4 channel, or I'm sorry, ChRNA4 gene. This up here is the NACHR channel, which unfortunately for nicotine abusers is not found in the BTA or the nucleus accumbens, but rather throughout the entire brain and the entire body, which is why nicotine is such an addictive substance. Normally, acetylcholine would bind to this channel. This particular genotype of the ChRNA4 gene actually changes the structure of this channel to make nicotine bind to it rather than acetylcholine. So next we'll talk about sex and gambling, two behavioral addictions that are due to the DRD4 gene. This area up here is the mesolimbic system of the brain. And it's responsible mostly for processing rewards, externalizing behavior, things of that nature. Unfortunately, with the particular mutation of the DRD4 gene, it alters the response to dopamine, and thereby rewards addiction. They found that with this gene in particular, it was very susceptible to environment. Children who were in an environment where parenting may have been a little bit poorer were much more susceptible to the effects of that DRD4 gene, whereas those who were raised in a household with sensitivity, particularly on the maternal side, things of that nature, actually were a lot less susceptible to the effects of this. So we're going to get away from all the genes and pathways for a moment and talk about my personal favorite part of the brain. This is the hippocampus, and all of these cool pictures up here were from a study done by Jose Amant and his team at the University of Colorado. They discovered that looking at the hippocampus, and this is a medial, right lateral view, right medial view, they discovered that there were severe inward deformations actually found on the surface of the hippocampus bilaterally in individuals with a high IQ. And that can be shown up here. They used a Gaussian method to determine a significance level of 5%, and they found that anything with 0.001 or 0.1% was highly significant. The red up here on this high level represents outward deformations, and the purple represents inward deformations. And up here you can see the P for posterior and the A for anterior, and there's a whole lot of purple on every anterior section of the hippocampus, showing those deformations. Down here, this picture shows the, again, medial right view of the hippocampus. They used a scatter plot to show the strong inverse correlation here. You have your IQ scores going up positively, and this actually shows the distances based on where that arrow is pointing at the surface of the hippocampus. So you can see a very strong correlation here, which further proves the idea that there are these severe inward deformations. I did want to point out over here that they also researched the amygdala to find out if there was anything significant going on there as well as the hippocampus. The amygdala is noted as red and purple. I see it as purple and more purple, but that is why they are doctors and I am not. And the green and blue would represent the hippocampus. They did not find anything significant at all about the amygdala. I thought that was important to note as well. So in conclusion, we're starting to notice a much, much, much higher correlation between individuals with high IQ and addiction, which seems kind of counterproductive to past studies. The theory was always individuals with lower IQs are going to have more of this because individuals with high IQ, even though they're smart, they don't get involved in this stuff. Turns out it's the other way around. So as more genetics and neuroanatomy are coming into play, we're starting to see a lot of interesting correlations. My personal hypothesis actually is that the inward deformations on that hippocampus would affect the firing rates of the VTA into the nucleus accumbens, thereby affecting the jugular nervous system and potentially changing the way an individual with a high IQ anatomically processes a reward. So hopefully more studies can be done, more things can be found, and we can help these individuals because they're really some of the greatest minds we have, and it would be a shame to see that go to waste. So are there any questions?
Okay, so you talked about how these people our brains are theoretically bored. So those with higher IQs go for, you know, the amphetamines and cocaine and such and alcohol. What about those people who, I don't know how to say it, but for example, suffer from a mental illness such as major depressive disorder or, you know, severe anxiety, and they take these, they take things like benzos, like Klonopin and Xanax, and then become addicted. Would you say that it's more, would you say that that is specifically, it's a neurological thing that they're becoming, because of their disability, they're becoming addicted, or is it just they're bored? I mean, I don't know if I'm making any sense. But.
Yeah, the biggest part of that particular section of my presentation was really stressing the psychology of people going out and all of a sudden finding, you know, these psychostimulants like cocaine, like heroin, things that are not normally prescribed. Anything that's prescription, you look at Vicodin, you look at Valium, you look at Percocet, things that are prescribed on a regular basis to people, you hear all the time. Some of them become severely addicted and others have no effect. And I think a lot of that could be based on this genetic analysis. I haven't researched far enough into it to know if there's a particular gene for certain medications like that. But I do feel that it's neurologically based. I don't think in that case they're bored. Yeah, I think it's more of they skipped over the psychology process because it was prescribed to them, and now their anatomy is just kicking in right away.
Gotcha. Okay, thank you.
No problem.
I'm actually going to go ahead and open up the question and answer session for both presenters. So if you have questions for either or, you can feel free to ask, and we'll do this for a few minutes, and then we'll go into a roundtable discussion. So.
Can I ask you a question? From my understanding, the hippocampus is the memory center,
Right.
where memory happens. But if you said there's deformations on the hippocampus of people with higher IQs, how do you think that plays into maybe memorizing things in terms of like information you would need?
Right. There's actually, well, the hippocampus is mostly long-term memory.
Okay.
Right, and there's actually a very interesting correlation that I've been studying lately because for some reason I have a strange obsession with the hippocampus. They also found inward deformations on individuals with schizophrenia. So I'm exploring that like right now to look for the correlation there. But what they find a lot of times with individuals with schizophrenia is they do have distorted memory. So I think there's a very high correlation there between having those inward deformations and having some kind of issues with long-term memory or perhaps skewed perception of long-term memories, something of that nature. I definitely think there's a probable correlation there.
A lot of the suggestions that you had to help these people that do have higher IQ scores to, you know, live a normal life, for a better word, would you say the suggestions that you had were medications, and I would list them to be non-invasive? there are other invasive methods like neurosurgery that may help the course of the cell structures that you showed us before. Would you suggest those? Or would you say that that is choosing like the greater evil?
Well, at this point, I don't think we know enough genetically or neuroanatomically to even come up with a medication that might be able to help these individuals. I think the major point I was trying to hit home was a lot of it is initiated by the psychological standpoint, and I think if we can kind of nip it in the bud, for lack of better terms there, before it happens, I think that's going to help a lot of these individuals. There are certain signs you can pick up. For example, teachers are normally the first to notice it because they'll start to notice individuals missing from their classes a little bit more frequently, things of that nature. And I think if we can kind of hold a bit of an open door policy where a student knows they can go in, they can trust somebody, they can talk to that person, they're not going to be judged for it, and kind of nip it before it gets to the point of a severe dependency, at that point we can help them a lot more than introducing something else they might get addicted to.
This has been an ongoing process of looking at illnesses like this through a psychological standpoint. And as you have said, there is still research going on, there's still case studies going on. So would you not say that a more invasive method would be a better way to go, a better way to introduce at this point, so that these people can be helped? I mean, I know you have a bias on psychology, but...
I have a huge bias on psychology. Well, it's interesting that you say that, because the idea of addiction as a whole is still taboo. Now we're introducing this idea of the people that are supposed to be the smartest individuals, the people that are supposed to have this greater degree of awareness are coming into play. And it's taking an already taboo subject and making it, that much more difficult. So society actually has not really given us much opportunity in the field to do research on it at this point. Hopefully that changes. So I would love to say yes, I think an invasive approach would be great. I want to go into surgery myself, so I naturally need to look at those invasive methods. But I don't think there's enough knowledge right now to understand the full cause of it. I think possibly, like I said, exploring my hypothesis of those inward deformations, find out what causes them, things of that nature. I really think we need to have a concrete, okay, this is what's going on inside the brain before we can talk about something that invasive.
I can see you're going to stick to your psychology guns.
Going off what Deviana said, have you found in your research any correlation between people who have positive addictions that lead to other releases of dopamine? For instance, musicians and artists who do perform an action that is pleasurable to them.
Yeah, my faculty mentor and I actually joke about this. There's the AMPA gene that causes addiction to running, and I just finished running 71 miles a month ago, so we do actually joke about this. Interestingly enough, I think almost any addiction to a behavior, in a sense, can be considered almost positive, because when you look at our ancestors, having an addiction to running might not be a bad thing. They're running from both prey and predators. Having addictions to sex might not be a bad thing. They're forced to reproduce in order to keep our species alive. So when you look at things like that, you have to look at it from an evolutionarily novel standpoint. How things are slowly being introduced to us, like cavemen didn't have gambling. So things are just slowly being introduced to us, and as things are being introduced to us, we have to ask ourselves more questions like this and ask ourselves, okay, how do we handle this one? What causes this one? And I do think that there is a place for certain addictions of that nature. It's just a matter of how that particular individual handles it. Like I said, the definition of an addiction itself is something that causes harm and interferes with daily activities. If they can manage that on a level, then I don't foresee it as too much of a problem anymore. Yeah.
Two questions. One, would you say that the symptoms of addiction for a person who has reportedly a high IQ and a low IQ are identical?
Not exactly. And that's a very, what happens with individuals with high IQ is they they are very good at masking things. That's why they have a lot of psychological and psychosocial disorders, for lack of a better term there, because they're very good at playing a facade and masking symptoms that would otherwise be very noticeable. Individuals with lower IQs normally are not able to do that. They do have a tendency to externalize more behavior. So you might see an individual with a low IQ and an individual with a high IQ walking down the street simultaneously addicted to the same substance, and the way you're going to view them is going to be different.
We have time for one more question. I know we have one over here.